When Taya Haselhorst was born, she failed her newborn hearing screening on the left side, and her mother, Ashlee Haselhorst, did not know why. She soon found out when Taya was 6 months old that Ashlee had been sick with cytomegalovirus prior to becoming pregnant with Taya.
I didn't know that the virus was still active inside of me, and so we got pregnant with Taya, and that's when the damage or the virus kind of had attacked her. And so what happens is a lot of time is it affects their hearing, their vision, and their balance.
The virus affected Taya's hearing in her left ear and eventually took her right ear around 3 years old. Shortly after, physicians said Taya could qualify for a cochlear implant. A cochlear implant is a hearing device that attaches to the auditory nerve to send signals to the brain, but the nerve must be intact beforehand to work properly.
If the nerve is not always stimulated, then you can't do the surgery, or it won't likely work because the cochlear implant needs to be situated on the nerve. So without the nerve being functioning, the surgery would not be successful.
They attached the implant on the left side, and she wore a hearing aid on her right ear. It took many weeks for Taya to be acclimated.
When they activate it, they start at a very low volume, and it starts out, your brain has to adapt to the internal piece and figure out how it works. So it will start out with just beeping noises or very monotone. There's no pitches, there's no voices, you can't understand words. So everything sounds very robotic or almost like TV static.
Taya's implant worked for 7 years until it stopped working on Christmas morning when she was 11. She had her second implant surgery a couple weeks later, and her brain had to relearn how to use the auditory nerve. It was around this time when Ashlee decided that her family needed to learn sign language.
At the end of the day, Taya is still deaf and hard of hearing. When you take those devices off, there's not a lot of, she cannot hear a whole lot. And so as a family, we've decided 4 years ago or 5 years ago to start learning sign language so that way we can always communicate with Taya.
Throughout her life, Taya learned to advocate for herself and her needs, and has always been able to teach others as well.
Taya's learned to advocate for whatever needs she needs for hearing, like closed captioning. She'll have teachers that have a hard time figuring out closed captioning, and she'll teach them.
And she has used that ability to inspire other girls who are experiencing similar challenges.
I have met some little girls who also wear hearing aids, and this past year I've been trying to meet with them when I have time or go to their schools and go read books with them just so that they can see that there are other people just like them.